There are a lot of things that we've done clinically that have been made possible through philanthropic giving. We've been able to buy some new equipment that has been very helpful, some cutting-edge equipment. We now have 3 Titan ultrasound machines from Sonosite. What these machines allow us to do is to diagnose in minutes some very critical, life-threatening emergencies like aortic aneurysms and things like that that might have taken much longer to diagnose if we didn't have these machines at the bedside. We've got new digital x-ray equipment, portable equipment, which allows us to, within just a few minutes of a trauma patient arriving in the emergency department, we have an x-ray taken and it's immediately visible on the screen. So there's no time delay in being able to see if the patient has major thoracic injuries, chest injuries, for example. We can diagnose it immediately. And this has been, again, from some of the philanthropic gifts that we've had recently. We've also, very key to our program has been some personnel additions that we've been able to do through this. We've added ED technicians, which have allowed us to have radiology technicians spending all their time taking x-rays as opposed to going back and forth getting patients for x-rays. Our ED technicians can take care of transporting patients back and forth to x-ray. But even more importantly, they allow us to do things like make sure that anybody with chest pain that comes into our emergency room has an EKG done within 10 minutes. That's our standard. We want to know within 10 minutes that somebody's either having a heart attack or not having a heart attack by their EKG so we can get care started immediately. And having these people freed up to do that allows us to maintain that standard. We started a concierge service in the emergency department waiting area. One of the big things when you come into the emergency department with a loved one and the loved one gets taken back to the treatment area is communication. What's going on back there? What are we waiting on? You know, what should I be doing? And this is something that the concierge people from our community services office has been able to assist us with. So we have 24/7 concierge service out in the waiting area. And this has been a huge asset to us in terms of facilitating communication and satisfaction for families. And one of the things I'm proudest of is our callback nurse program. This is a program that we instituted a little over a year ago now. We have, for 16 hours a day, we have a nurse in the emergency department who's dedicated to calling patients back to make sure that they were able to get into the clinics they were supposed to get into to follow up for whatever problem they came to see us for, to be sure that they were able to get their prescriptions filled, that they're taking their medication appropriately. If anything comes up, such as an abnormal test result that comes back later after the patient has left, they follow up on that. If we have people that we just want to keep tabs on how they're doing, maybe we've got somebody, again, who's older that lives alone, and we just want to make sure that they're faring okay, we just let these nurses know, and they'll make a call the next day and check on the person. So this has been huge. As a matter of fact, last month, this is actually our group of callback nurses, and last month they won a national award from Advance for Nurse as the best nursing team in the nation. So this has been a huge asset to us, again, made possible through philanthropic giving. So the paradigm shift for us most recently has been the attempt to go with an electronic medical record, EPIC. I call it an EPIC change. Early this month, we launched EPIC in the hospital as an electronic medical record, essentially trying to go paperless in the emergency department. And we made the difficult decision to go live with that right with the hospital and not try to wait and see and ease into it later on. And so we're having some challenges right now with that. There's no doubt it's going to be a very effective system once we're all very comfortable with it. It's going to reduce errors, I think, because it allows us to pick up on potential medication interactions, or if someone inadvertently orders a medication that perhaps a patient had a prior allergy to and it wasn't listed initially, then it will pick up on that. It's going to be a very good system. This is just a screenshot from EPIC. This is just the emergency department. This is 5 days ago. And you can see how busy the emergency department is, for one thing. But what EPIC is allowing us to do is keep track of what laboratories are out there, what's back, what's ready to be looked at, what the status is of the patient in terms of being where they are in the process going through the emergency department, or if they're ready for admission, or what consultations have been requested. So it's going to be a good system. The problem is that historically, when electronic medical records go into places, it reduces efficiency by about 20%. And obviously, from everything else I've told you here, that's going to be a problem for us. and we're working on how we're going to deal with that. We're increasing physician coverage. We're getting support from the hospital to increase nursing coverage to allow us to deal with this, because what it does is it takes care providers from the bedside to the computer to put in orders, to do all these kinds of things that clerks could do before, and now we're doing those. So efficiency overall, once we're very good with this, is still going to be down to some degree. So just very quickly, I want to go through some of the physician names that you may have heard at times or seen in the emergency department. Dr. Paul Auerbach, who's going to be our speaker here tonight. I see Paul is here. Congratulations to Los Altos again for the great victory tonight. Paul has been a mentor and a dear friend of mine for a number of years, since my early days back at Vanderbilt. And he has come back to join us as our Director of Special Projects to aid with strategic planning. And I have to say a special word about Paul. Paul, last year, won the 2008 award from the American College of Emergency Physicians as a hero of emergency medicine. That's an incredibly prestigious award. That's a huge honor for Paul and for our program. So, another thing that I just want to point out about Paul, and you heard a little bit about this from Shelley, was that Paul has an expertise in marine envenomations and things like that, and he's arguably the world's expert on shark attacks. And from time to time, this is the scene that you'll see in our emergency department waiting area, as a matter of fact, so, as word gets out. Dr. Dannenberg, I've already mentioned, is our Director of Pediatric Emergency Medicine. Dr. Dan Garza, one of our former emergency medicine residents in the program, went on to do a sports medicine fellowship and now handles the sports medicine aspects of the emergency department and is also the team physician for the 49ers. Dr. Gilbert's our Life Flight Medical Director, and he's also EMS Director for San Mateo County. Dr. Phil Harder's our Residency Program Director. Dr. Mahadevan is the Associate Chief and Medical Director for the ED. Again, I'm the Chief of the Division of Emergency Medicine. Jim Quinn's our Research Director, and our research efforts in the Emergency Department are going very, very well. Dr. Schreiber is our Process Improvement Director, Quality Improvement, Quality Assurance. Dr. Smith-Coggins is the Associate Dean for Medical Student Life Advising. Dr. Strelo is director of that new clinical decision area I told you about, that 23-hour observation unit. He's done a phenomenal job with our nursing staff in putting that together. Dr. Wong is associate director of pediatric emergency medicine. Dr. Weiss, I've mentioned, is the chair of our disaster and bioterrorism committee. Dr. Sarah Williams is director of our entire ultrasound program in emergency medicine. And these are just some of the areas of research that we're actively involved in at this time. Simulation training, as you're going to hear about in a little bit from Evan, is just an exciting area of being able to train residents and students and even attending physicians in how to perform invasive procedures in an environment where there's no risk to a live patient because you're doing it on a simulated patient with very high-tech mannequins. So that's an exciting area of research, how that impacts quality of care. Stroke, coronary disease, airway management, all these areas are areas that we're actively involved in research at Stanford. Our physicians do a lot of publishing and teaching, obviously. This is Dr. Auerbach's most recent edition of his Wilderness Medicine textbook, which is without doubt the Bible of emergency medicine out there. I'm sorry, Wilderness Medicine. This is his companion text, Medicine for the Outdoors, a little smaller and easier to carry in your backpack. Dr. Weiss did Wilderness 911. Dr. Mahadevan, our associate chief, was co-editor of Clinical Emergency Medicine, which is a relatively new textbook that has become the standard for training new emergency medicine residents and medical students, and actually in 2006 won the American Medical Writers Association Book Award for the physicians category. So it's a phenomenally well-done book. We do a lot of teaching in the medical school and in the undergraduate school as well. These are some of the courses we teach. Introduction to Emergency Medicine, for example, Wilderness Medicine. We teach CPR to all the medical students in the School of Medicine. And we've started a couple of years ago now an Emergency Medical Technician course, which has actually blossomed to the point that there's an EMS service now student-run on Stanford campus, which is basically fed by people who are graduating from this program.